So this is a patient who has come to do sleep study. This one we call it a hospital-based sleep study, whereby an individual comes and then he go through the sleep study over the night. Some day we do it like up to 1, 2, 3 days, some just a night, and depending on our decision. Patient comes and then he go through this procedure. We call this procedure polysomnography study. That's sleep study, commonly called sleep study. It's all about to find out what goes on when an individual is having is sleeping and at the same time snoring. You want to measure all the parameters and then look at all of them together and know the system that are affected during his sleep period. Now there are two types of sleep study. We have the hospital based, whereby patient comes just like this one, and then we attach this polysomnography machine over the night. And we also have the other type that patient takes home for the same sleep study. The difference between them is that the other one is just the number of channels. Some of them they have 9 channels, where we can just get the basic factors we are looking for. It is that one could measure the give us oxygen saturation, the pulse rate, snoring, and also as well as the obstructive sleep apnea. Okay, like the one we are using currently, with 22 channels polysomnography machine. It has 5 major components. One of them is the electroencephalogram, which will measure the brain wave, and then you want to know if the brain is resting or want to know the pattern of the brain wave during sleep. And then we also have the one attached below, one on the right side and another one on the left side of the eyes, which we call electroencephalography, which is also to measure the variation in the electron discharges of the 2 eyes. So all of these, we put them together to know what's going on when an individual with a problem with sleep disorders, is sleeping. And beside that, we also have the electrocardiogram, which is attached to the chest. It measures the cardiac activities while the patient is sleeping, because we know some of them don't get enough oxygen during the sleep because of possibly obstructive sleep apnea or whatever happens. The heart activities will also reflect some of these problems. Of course, you can see the one attached to the leg, which most times we use it, to measure, especially patient with rest leg syndrome. So this one will also help us to know if patient has this problem. And of course, you can see other components. So you can see the one attached to the nose. You can see the other two systems attached to the body. One measure the chest movement, the other one measure the abdominal movement. Then of course you can see the pulse, the one that will measure the pulse oximeter and oxygen saturation attached to the finger. So all of these simultaneously work together to give us, at the end of the day, what is going on when an individual is sleeping, especially that has to do with sleep disorders, obstructive sleep apnea, and all these other different sleep disorders problems. So we do this to be able to make the diagnosis in the first place, because the first thing we need to do before you can manage a patient that has obstructive sleep apnea or has other sleep disorders is to make a diagnosis first. And polysomnography will be able to diagnose this problem. It will be able to tell us if an individual has this problem. One. Secondly, it will tell us what level, what category. Is it mild? Is it moderate or severe? Because all of this will help us to help the individual or the patient who has this. Now, it is a practice all over the world that if you want a patient to come to the hospital and have this done, it's better to make the place homely. That's why you see that this place look like more like a four-star hotel, whereby a patient, is able to relax, because you don't want a feeling whereby the patient, find it difficult to sleep. Make patient to relax well, so that he can sleep well and then have good assessment. So the advice is that snoring is not normal. When you have this problem with snoring and other sleep disorders, it's good to just come and assess yourself, find out if your snoring is habitual. We have habitual snorer. If your snoring is just snoring that is not affecting your system, so to speak, and if you want anything done about it, has to be now social issues. Of course, we know at times the sleep partners who have problem with your snoring, even though it's not affecting you, which you can do something about it. Then you could have a snoring that's already affecting your system. I hope you know, and I believe you know, that snoring on its own, it could lead to secondary hypertension. It could cause a cardiac problem. It could degenerate to cardiac arrest, stroke, and in fact, the studies have shown that it can lead to diabetes. It can also cause even glaucoma in some patients, in some individuals. So when you have this problem, don't leave it like that, because snoring is not normal. You need to find out what is causing it. Thank you. I'm Dr. Folorunso David, ENT surgeon with University of Abuja Teaching Hospital, and I'm a visiting consultant to few of these centers where they evaluate individual with sleep disorders. Thank you.
My name is Nurse Uchoyidum. I'm working with ENT Clinic Sleep Study Center. Thank you so much for volunteering to create awareness about sleep study. Thank you so much. How would you describe your experience?
It's a very good experience. For me coming here to have passed through this, was I've not been sleeping well before, but after this procedure, when some machine was even attached to my body, I didn't even feel any pains at all. I don't even know something was on my body. If not after they remove it, understand that I now know that a lot of things have been I went through.
Okay, thank you so much for your honest response.
You're welcome.
Please, I don't know, what would you advise the public about sleep study?
My advice is that whoever have not been sleeping well or is snoring should just come down and have him or herself checked.
Thank you very much for watching this short video. The purpose of this video is to create awareness of sleep study. You don't need to go to Dubai, UK or US to have sleep study done. Sleep study is now done in Abuja. We have 5 centers here in Abuja: Childcare Hospital, Well Life Hospital, Arewa Hospital, Citadel Hospital, and Millfield Hospital. This video you just watched is sleep study for hospital-based. We also have sleep study for home-based, where the patient can go home and have a sleep study done. We also have drug-induced sleep endoscopy. This enables us to observe where the patient have obstructions and to manage properly. Visiting consultant Dr. David Femi Folorunso, ENT head and neck surgeon, comes to review the results and also offer treatment based on the results. Our numbers are being displayed on the screen. If you have any questions, please do reach out to us. Thank you so much for watching.